So here at SimulEYE, our mission statement is training surgeons, supporting industry, improving outcomes. And that's really been something that's developed over time. It really started with training surgeons. So I help train myself and get my skills up, and then I try to put that out there to the community and help support residents. And as we built more and more models, we found that we weren't just training residents, we were training established surgeons as well, if they wanted to check on trying new techniques or things that they weren't comfortable with or needed more practice, different suturing techniques or new devices that were coming out. So a lot of it initially was geared towards resident education, which is fantastic because that's where we can have such a big impact. But over the years, it's really grown into training all surgeons, not just residents. And we really can have such an impact on the learning curve with residents and established ophthalmic surgeons because really the time to try new devices and techniques and lasers is not when you're there with a patient. The time to be comfortable with that is before you get there with a patient. Really understand the device or the machine that you're using and have a chance to play with it and get everything worked out ahead of time as much as you possibly can. And so that's really what that component of training surgeons is all about. That's where it all started. As things evolved, we got more and more connected with industry, and all the biggest players in industry, from Alcon and Johnson & Johnson to New World Medical and MST, and just on down the road. We're allied with so many of these top industry partners, and I would see the need that we would need to make a Model I for a given device. For example, when femto technology came out, we had one of the first femto lasers. And the training on that was really challenging, and the models that they had to train us on were actually made it more difficult. And so I saw an opportunity there to make models, a much better model that could work with that femtosecond laser and all the software, so that we could really learn it outside of the operating room setting and play with it and understand all the settings. And then on the day of surgery, it was just much more natural and easy to work with the patient. So in bringing that technology that we made to the companies, we were able to support them, and they could then in turn train the surgeons and go out across the nation and even across the world. So we've had a big impact there. And then ultimately what this really leads to is improving outcomes. That's really what it's all about at the end of the day, is to flatten the learning curve so that we have better results from day one. And that's true not only with residents, but also, again, established physicians trying a new technique or a new device. So that's where we come up with our mission statement of, first and foremost, training surgeons, supporting industry, because that has a bigger impact on training surgeons than we can do alone. And ultimately, it's all about improving outcomes in our patients and getting better results for them.